Good afternoon, everyone. Welcome. Thank you so much for coming to the new normal post-COVID hospitality and restaurant operations. My name is Cheryl Stanley. I am a senior lecturer here at the School of Hotel Administration at the Johnson College of Business at Cornell University. And want to thank you again for coming. And thanks the sponsors, the Center for Hospitality Research, Cornell, and the School of Hotel Administration for this very, very important keynote. And we have an amazing panel today to learn from, hear what's going on in their individual areas, so we can all have some key takeaways to protect ourselves as well as to protect our operations and businesses. Because we know COVID is around us. Our world is in flux. And we were hoping this is post-COVID, but we're still in the thick of things. And we talk about it, I know I personally speak about it at home. We talk about it at school every day. And we also talk from the hotel school side, working with our hospitality partners on how can we be helpful to them in managing and navigating this current pandemic. As I mentioned, we have 4 amazing panelists with us today. Our first panelist is Chrissy Gamble, Vice President Planning and Integration for Four Seasons Hotels and Resorts. We have Dr. Clare Rock, Associate Professor of Medicine at Johns Hopkins University, Dr. Jonathan Zenilman, Professor of Medicine at Johns Hopkins University, and Ben Berg, founder and CEO of Berg Hospitality Group. So what I would like to do is ask each of our panelists to introduce themselves to the audience. Chrissy, please, why don't you go ahead and start?
Thank you so much, Cheryl, and thanks for having me. As Cheryl said, I work with Four Seasons Hotels and Resorts, and I'm on the global operations team. So I work very closely with our hotel residential operations, as well as our residential and design teams, as well our sales and marketing. So we work really horizontally across the organization, and I've had the benefit of working with the team at Johns Hopkins Medicine International, who have really guided us since gosh, I can't believe we're still talking for the last 18 months of this year, just in developing our program. So we have a program called Lead with Care. That's our Four Seasons Enhanced Health and Safety Program. And we really couldn't have done it without the assistance of the medical experts that I'm proud to introduce you to today. So we have on the call Dr. Clare Rock, and I'll hand it over to her for a brief introduction.
Thanks, Chrissy. So great to be here. So I'm an infectious disease physician and associate professor of medicine at Johns Hopkins. And really for the past year and a half, fully immersed in all aspects of COVID. One of my primary roles at Johns Hopkins Hospital is basically prevention of transmission of the virus between our healthcare workers and staff, and also keeping patients safe. And so this really involves everything from personal protective equipment to vaccines to testing to implementing physical distancing and contact tracing, really across the full gambit of COVID prevention. And my second role as an infectious disease physician is unfortunately seeing those people that come into hospital and require hospital admission with COVID illness. And this really sort of brings it home when you do see people that are really critically ill and requiring huge amounts of respiratory support and intubation, etc. My third role is as an academic researcher, a lot of grant funding, primarily from the Centers for Disease Control and Prevention and the CDC. And so what's been COVID related about that has really been evaluating different types of salivary antibody testing, methods of physical distancing and how we can incorporate human factors engineering to help with physical distancing in the hospital, and also different types of masks and which masks are effective. And then as Chrissy so nicely outlined, my other role is really in helping support hospitality, travel, businesses, events, return to work, and really the array of areas where COVID is affecting and people are really needing help to translate the guidance into realistic practices that they can incorporate in their workplace. And so Dr. Zenilman and I have been working with the Four Seasons on their Lead with Care program for the past year and a half, and have really seen all the trials and tribulations as the pandemic has progressed. So Dr. Zenilman, I'll hand over to you for your introduction.
Okay. Sure, thanks, Claire. You forgot to mention that you have 2 kids in addition to all the other stuff which you pointed out.
Who are just back to school now, so a lot of angst in our family, you can imagine.
So it's also my pleasure to be here. As was noted in the announcement, I actually graduated from Cornell in 1977 with a bachelor's degree in chemistry, and then went to med school. So my first day of my internship was also a couple of weeks, 2 or 3 weeks after the first case of AIDS in the United States. And we saw a lot of AIDS. It was a terrible time, but the beginning of my training was also framed by a major epidemic. And it's kind of ironic that we're seeing a lot of similarities right now. As Clare is, I'm an infectious disease clinician and also an epidemiologist. I spent 4.5 years at the CDC prior to coming to Hopkins, and worked very closely with the Baltimore City Sexually Transmitted Disease Program, which has been primarily the focus of my research for many years, which actually does a lot of contact tracing as part of its work. I was also chief of infectious diseases at one of the Johns Hopkins hospitals until 2019. And for the past almost 2 years now, past year and a half, as we all have, I've been working almost exclusively on COVID-related activities, doing work very similar to what Claire has just mentioned. In addition, I'm also on one of the data safety monitoring committees for one of the major vaccines. So actually we've been working very closely with our inner city communities to try to work on, besides safety issues, to really do a lot of community work to increase the vaccination rates. I think I'll hand it off to Ben.
Thank you, Dr. Z.
Well, that's a lot to go after. I'm just the guy who sells steaks and booze. But I'm Ben Berg. I live in Houston, Texas, originally from New York. I graduated from the hotel school in, I think, master's in 2005, 2004. But I'm down in Houston. We have 7 restaurants right now. We have 2 under construction, 3 in development, and 2 more to come, probably all within the next 12 to 14 months.
Wow.
We've had a lot of growth probably in the past 6 years. So, and I think we're lucky to be in Texas during the pandemic for a business point of view, but it's been a wild ride, let's say.
Thank you, Ben. Chrissy, I'd like to ask you the first question. The Delta variant, which we're hearing so much about, and other variants of SARS-CoV-2 they're impacting everyone today. How are they physically affecting humans, and what are your thoughts on some human behavior modification that someone could implement in order to protect themselves and others?
Sure, I'll start. I think, for us at Four Seasons, so we operate in 47 different countries. We're at 121 hotels in our count today. So we are seeing, as part of my role and part of the team that works on Lead with Care, we're seeing what's happening in the hotels. So firsthand from, the employee cases to guest cases. And we are definitely seeing what everyone's seeing in the news, a resurgence and spikes in different parts of the world and of course, in the U.S. And so, this for us, we did recently reenact our mask policy for all of our employees. So this is, I think, the most important human behavior that we stress with our employees. So we had previously allowed employees that showed proof of vaccination to go unmasked while they were at work. But because of the prevalence and what we're seeing with the Delta variant, we have all employees in the U.S. do require a mask to be at work. So that's really important. Throughout the pandemic, we've always encouraged distancing in places like our employee dining facilities. We call it the heart of house, which are our areas that the employees work in, housekeeping and otherwise. So encouraging physical distancing, staggering schedules, and of course masking, and also promoting vigilance outside of work. I think, oftentimes in cases that we've seen across the portfolio, people of course are contracting COVID outside of work through gatherings and potentially through the household. And so, just reminding people that this is still, though people are very fatigued and they are tired of hearing about COVID and they're tired of, doing all of the necessary safety precautions, just trying to re-energize that and making sure that we're keeping them safe and as well as our guests and our residents safe.
Thank you.
I would add something to that, because I think it's also important to understand specific issues around the Delta. One is that Delta is not the last rodeo. We're going to be seeing and the history of this is we see new variants come up about every 2 to 3 months, and there's a couple coming our way after this. But what happened and why the Delta, the issues with the Delta are, one, it's much more infectious than the parent strain. There's 1,000 times more virus in the nose in people who have Delta compared to the parent Wuhan strain. And the other thing is that we've learned over the past month or so is that even if you're vaccinated, you can become infected with Delta. You're protected from serious illness and death. So it's not like the vaccines don't work. And I think that's a misperception. But you can be, so therefore, with that in mind, and a large number of people are still prevented from getting infected in the first place, but it's not 100%. And therefore, the reasons for masks and social distancing have become more important, especially with the emergence of this variant.
Thank you for that information. It's so important to wrap our head around, to understand these. And I want to thank also, we're getting some questions in the chat. Please continue to post some questions. I'm going to be asking them to our panelists in just a moment. Dr. Rock, next question. Hotels and restaurants, as someone who has worked in both hotels and restaurants, the operations have historically showcased their cleanliness to their guests by wiping down surfaces. But because COVID-19 is an airborne virus, that poses a challenge. How can hospitality operations prevent the spread of the virus through the air, knowing what we know today?
Yeah, Cheryl, this is a great question, and it really allows us to understand how science evolved during the pandemic and how now we just have a much clearer idea and clearer knowledge about how this virus transmits. Because if you remember back, more than a year and a half ago now, we had not heard of COVID-19 and we didn't know really so much about the virus. And even looking at other viruses that had been similar before, we couldn't really understand at the beginning, how does it exactly transmit and what are the best pieces to do to prevent that transmission. And so now it is extremely clear and well understood that the infection spreads primarily through the air. And by air, we mean that it comes out in large or small droplets called aerosols as we speak if we're infected. And so that's the main thing, those particles out in the air, and then if they get breathed in by somebody else or onto their nose or into the mucous membranes of their eyes, that person can become infected. The second thing that evolved over as more scientific knowledge became available was the fact that people did not need to have symptoms in order to transmit the virus. And this was a huge piece that has really allowed for a lot of the transmissions, because people can be unknowingly very infectious and transmitting to other people. So that was another huge piece of scientific knowledge that really informed a lot of the approaches today. And then the third piece, as you say, initially we did think that there was, and it was very conceivable that there would be a lot of live virus that could be on surfaces, and then people would touch those surfaces and touch their eyes and touch their nose. And while that is still a possibility, we know that it's very, very much less likely to be a cause of transmission versus that direct air inhalation. And so now you will see a lot less focus in general over disinfecting surfaces and a lot more focus on what Chrissy outlined with the benefits of face masks, which is really indisputable. Face masks for everybody definitely work to decrease transmission of the virus. A focus on air, so fresh air, opening doors, opening windows whenever possible, a lot of attention on ventilation in any areas where there are people, particularly inside. And then the other piece that you will see is focus on physical distancing, or at least separating people wherever possible. And this includes in the workplace and the heart of house, where it can be difficult to do. And a huge focus also on people who are symptomatic, identifying that they're symptomatic, so at least those people can be identified and can be isolated at home and not potentially infecting in the workplace. So we really have seen changes that have come during this pandemic, and no doubt we'll see more, because what Dr. Zenilman and I and the rest of the group here are saying today may not even necessarily all be true in even a few weeks' time, because this is really still evolving before our eyes.
Thank you. Ben, could you speak about what you're doing in your restaurants to continue to ensure guest health and safety, as well as your team?
Yeah, I mean, I think with us, it starts with our team. Kind of from the beginning, one is kind of what they said, like identifying people. We just started back again, but we have mandatory testing every week that we do out of our office, which is complimentary for the whole staff. Because when this whole thing started, I mean, we were just getting caught off guard of people just like whole dining rooms getting sick and losing staff left and right. So just testing has been a real help. We've gone back to masks now. We had gone away from that, but now we're putting that back in. And we've mandated vaccinations, and we're offering it like in our office for all our staff. Every restaurant has days that they can come in, and we have doctors that come in and will vaccinate anybody who wants to. But restaurants is tough. Kitchens, it's hard to have distance. But it's really, kind of having everybody get on board that, they got to protect the person standing next to them, really.
Ben, the fact that you're bringing the vaccine to your staff really shows that you care about them, for their health and safety. And this actually ties into one of our first questions that we've received from Hakan. They ask, in preventing the spread of COVID-19 among employees and thereon to guests, how effective do you think rapid COVID-19 tests are? And so I think this question for Dr. Z and Dr. Brock.
Yeah, so I think, first of all, let's review very quickly the two major types of tests. One is the PCR test, which actually is very, very sensitive, but that has to be sent to a lab overnight in almost all cases. The rapid tests, which are becoming increasingly available, and in fact, I saw them at the drugstore. There's something called Abbott Binax. There's IntelliSwab. There's Ellume. These are tests which are what we call point of care tests, which can be done by somebody at home or in the workplace. They don't require, you put a swab into about 1/2 inch into the nose and twirl it around. And the results are available in 15 to 20 minutes. And you read it very similar to the way you would read a pregnancy test with the bands going across the strip. They are not as sensitive as the PCR tests. So sometimes people can still be infected, but the test will read as negative. But they are very good at picking up people when they are infectious, so when you can transmit it to somebody. And in fact, there are a couple of models which actually say that, for example, in colleges, and they're much, much cheaper than the lab-based PCR tests. These run now $5 to $10 a piece, and that's retail. So there are models where you can do more frequent testing, 2 to 3 times a week with these tests. But in settings, for example, if somebody thinks, and we're seeing this, in fact, we've been working with Four Seasons in proposing use of these tests for large event management, such as weddings or parties where folks will be unmasked, as an option of preventing transmission within the facility.
Dr. Z, that ties into another question that Joan posed. If there is a positive COVID test at a meeting in a hotel, what is the responsibility of the hotel to tell their staff, other guests, groups, and of the groups to tell others in their group of a positive test? So I think this is a good question for everyone, kind of thought, Dr. Z and Dr. Rock, what are we allowed to say? And then thoughts from Chrissy and Ben as well.
Claire?
Well, I mean, the main thing that you want to keep to the fore, right, is the safety of your employees and the safety of your guests and the safety of the people in the hotel. So I think keeping that to the fore really helps guide all the actions that happen from there on in. But typically, what we would be discussing with Chrissy and the team in that type of situation is, number one is who was the infected person in contact with during the time that they were infectious up until this positive test. How long were they in contact with them? How far apart were they standing from them? Were people masked or unmasked? And getting all that information to try and understand who were the potential people that could have been exposed. And from there on, it really is somewhat nuanced as to people getting tested and being quarantined, etc., based on that risk assessment. And quite often, the public health, state health department or local health department may also be involved in this process, which is called contact tracing, which is really trying to identify those people who are exposed and giving them the advice of remaining quarantined at home, and also advice about if they develop any symptoms to immediately get tested, and also testing before their full quarantine time is up if they wish to be removed from quarantine. So there's really a lot of advice that goes into that type of situation. And then from the hotel perspective, if it's a guest, obviously if they need medical attention, that needs to come fore and foremost, and making sure that we're getting the correct medical attention or getting them to emergency room or urgent care or whatever it may be. But many hotels will have isolation areas that person would immediately go into. And so making sure the person is masked and in a private room. And the Four Seasons have, in many of the hotels that Chrissy can maybe speak to, have actually a dedicated area for this purpose, because you want to have a safe place that the person can remain where they're safe, but they're not infectious to other people, while, in the early, initial hour or two while this is sort of evolving.
Now, I'll add 2 points to that before going to Chrissy, and that is, one is whether notification takes place, and I think is really, as Claire mentioned, is dependent on the level of exposure. So if you have a casual encounter in the hallway with somebody and both of you are masked, then basically there's not going to be any need for contact tracing there, especially if the folks are vaccinated. The other issue is that when folks are notified that they've been exposed, there's no privacy breach. You're just told that you've been exposed. That's not you're not told who it is. And this goes back to a long tradition of contact tracing from the STD world as well. Chrissy?
That's right. I think, for us, for all of our meetings and events, so that was really, as we went through the pandemic, one of the areas of concern for us. So, we for all meetings and events, depending on what phase the hotel is in. So we have, designated green, yellow, and red phases. We do recommend testing as the safest way to bring people together. In the event that, a guest does test positive, we do have as Claire had mentioned, we do have the ability to isolate guests and then, alert the necessary authorities and make sure that they're well taken care of and isolated from the group. As she mentioned as well, we would do contact tracing. So we would inform anyone that's been exposed, whether that's a member of staff, another attendee at the event. And then for the meeting planner, it's really, at their discretion to alert all of the group if they'd like, or just those that have been exposed to the positive case. So that's how we handle it. And I think all of the hotels are well equipped to have either a third-party testing provider on site to help with rapid tests and arrange that accordingly. As well, for all meetings and events, we still conduct screening for all attendees. So as people are coming in from outside of the hotel, we do a question and visual screening of all attendees.
Wow. We have a lot of questions coming in, and so I'm super excited about them because they're questions that are on the forefront of my mind as well. Let's talk about development. Chrissy, you have hotels in development. Ben, you have restaurants that are in development. So first question is going to be for Dr. Z and Dr. Rock. And then the second question will be for Ben and Chrissy. Dr. Z and Dr. Rock, new builds are great because you can work with the architects and the designers to take action when thinking about design and spacing. But that's not necessarily applicable or realistic for existing operations, and especially an operation with low financial liquidity. What are 3 easy steps an operator can take to protect their people and create a healthy environment for everyone?
I'd say it's all about, step number 1, it's all about the air. So I think ventilation. So in new builds, obviously, if you can look at the way optimizing ventilation in the space, and basically, with increasing the number of air exchanges per hour, preferably, over 6 if possible. There are some utility costs associated with that, but but generally, new builds will have adjustable air exchanges, high-level MERV filters, and also making sure the ventilation is going from the bottom to the top, from the floor to the ceiling. Airplanes are safe because the ventilation, there's lots of air exchange, and also the ventilation is going from the bottom to the top. There's a very prominent, well-known, at least in our business, infectious disease. There's a very well-known restaurant-associated outbreak in China early on in the epidemic when the air conditioning system was blowing across the restaurant and blew from a table with COVID-positive patients who did not know that they were sick and infected a whole bunch of other folks in the restaurant. So that's the type of situation you'd want to avoid. Claire, you want to take the next point?
Yeah, I think they're all critical pieces. And, this virus is going to be with us for many, many years to come. And I think we're going to be in a situation kind of a little bit like what Ben mentioned earlier when, and Chrissy also, we had employees not masking. Now things are different. People are masking again. I think that we're going to have to be really agile and flexible. And that's the way things are going to go over the next number of years, because we're going to have these constant surges and lulls and surges and lulls. And the surges will be with, as Dr. Z mentioned earlier, more and more of these concerning variants. So, I don't think Delta is the end of it by any stretch. And this virus is very smart and has thrown curveball after curveball. So if I was looking at, thinking about restaurant or hotel or any area where there's people gathering together, I would certainly be focused on the ventilation infrastructure that's in that building. And to all the points that you outlined, Dr. Zenilman, like what way are the air currents going? What is the infrastructure with regards the filters or the capacity of the HVAC system for these highly effective filtering systems? And there are different guidances out there. There's the ASHRAE guidance on buildings that give sort of specific guidance on ventilation. And I would be thinking that people now that are looking to rent out premises for this type of function should be knowledgeable as to what the ventilation infrastructure is in the building that they have. There are, low-cost things that you can buy, such as carbon dioxide monitors that are inexpensive in general, small devices that basically measure the amount of carbon dioxide in the air. And as we know, we inhale basically oxygen and blow out carbon dioxide. So if you have a room that has, people in it and there's a lot of carbon dioxide, and what that means is that the air is not being exchanged or filtering or being cleaned in the way that it should be. Because you should not be seeing a lot of carbon dioxide if the air is basically being filtered or cleaned. And so there are a few pieces like that you can engage. But I think for sure we're going to hear more and more about ventilation and buildings, etc. So I would recommend people to sort of have this to the fore, especially when thinking about new premises.
And I think, Dr. Rock, you brought up some great points that someone could take to their landlord and ask, if you're renting a spot for an operation, what type of airflow do you have? And so for those of you that didn't get to write down everything from Dr. Rock, this is going to be recorded and you can certainly view it again to pick out some of those questions. Ben, I want to know, the audience wants to know, what are you doing with so much growth and development in the company, which is just fantastic? Has it changed your mindset in the design of the different facilities and layout that you're working with?
Well, I mean, I would say yes and no. Obviously, actually some of these projects we had going before COVID, when you're stuck, we go into, we don't build, standalone spaces. So, and I prefer older buildings, but yeah, definitely the airflow. But, being in Texas and Houston, we actually already had things just to kill, from the blue lights, from the UV lights in our ventilation systems, just for stopping the mold that we have. So it's so humid, we live in a swamp down here. But for us, it's more trying to make our spaces more able to kind of be inside and outside spaces. So we're bringing more walls, we're bringing walls inside that we can open up and kind of create covered open outdoor spaces everywhere, and being really flexible with space that way. our private event spaces, all of them, we're trying to make them now. We actually, every single one, we usually private event spaces have no windows or closed off or put in the back somewhere. We're putting all of ours where they can be opened up and have windows, et cetera, just to get more air in it. And it's, you know, spacing out tables now. People are more aware of that, you know, that being grouped together thing isn't as popular anymore. And since we want to, reach everybody out there, that we have to kind of go towards that.
Has that change in spacing, have you had to modify any of your business projections or change your hours of operation to allow for them for higher turns?
Well, I mean, hours of operations kind of, that depends the area you live in, right? So like in Houston, God, it's like, you know, asking for their firstborn to eat after 8:30 at night. So it wouldn't really help us. But, you know, yeah, we base all of our forecasts, everything based off of covers. So our assumptions always start with our cover and our you know, average check. So yeah, that adds it, but you know, there's ways to move it around and raise the average check a little bit. People will pay for you doing a good job and caring. We've noticed that.
Good to hear.
Yeah.
Chrissy, can you tell me about the hotels in development, any changes that you're seeing for layout and design?
Sure. I think, you know, it's a lot of what Bennett said, especially when we think about our meeting space and our restaurants and bars, like as much as we can and climate permitting, offering outdoor space has become more of a focus and something that, you know, people want to do events outdoors versus in a ballroom. So really reimagining meetings and events as we go forward. I think, you know, one of the things that Dr. Z had said at the outset of the pandemic was that it's really, you know, it's not going to be the last pandemic that we'll experience. And so as we build new hotels, you know, making sure that we're doing so, we're having isolation rooms closer to the entryways, you know, so that we can do this. I think all of our hotels, when we began, you know, putting all the safety protocols in place, we would have to set up, you know, really makeshift isolation rooms or take luggage storage or closets and really, you know, think about if someone didn't pass screening at entrance, how we would make sure that we were, you know, isolating that individual. So as we go forward with design, thinking about how we include that, of course, as Dr. Z and Dr. Rock, you know, both thoughtfully touched on, air ventilation is so important. So making sure that that's something that is a high priority for all new development as well.
And Chrissy, Rashan submitted a question and would like to ask you, has Four Seasons modified its practice of serving food in any areas of the hotel and not necessarily limiting the service exclusively to the restaurant?
Sure. So it's a good question. I think, you know, one thing that we saw at the beginning of the pandemic when we had many just restaurant closures because of government restrictions, local government restrictions, you know, we did a lot of takeout. That was something that we really expanded on was, you know, takeout, but not just takeout meals, like at home kits, and expanded our offering there, which is something that people, if they weren't able to go outside, they could experience Four Seasons at home, which was many, of course, the leading restaurants, and I'm sure Ben did a ton of takeout in Houston as well. So that was a new way, really because we couldn't utilize other spaces of the hotel, gathering spaces or meeting rooms. That was our option. And you know, the in-room dining is always something that became more popular when the restaurants were closed because people could eat in their rooms. But that was really the extent of what we could offer from a food and beverage standpoint outside of the restaurants and bars.
Thank you. Ben, are you still seeing a lot of to-go experiences asked for and purchased by your guests, or are you seeing your sales mix kind of shift more to in-person?
No, I would say our sales mix has really shifted towards in-person. I mean, we also, the majority of our restaurants are higher ticket priced places, more fine dining. So we did great. I mean, I was surprised, when we were doing takeout and to go. But now it's really, I would say it's really dropped off to maybe only 2 to 3%. But hey, it pushed us really fast to, get on board with technology, all online ordering and everything.
Which some operations have said have saved them.
Yeah.
That would never have implemented before.
No, exactly. Probably never, especially this fast.
I'd like to transition to speaking about the team, your employees, and first question for Dr. Rock. We know of mental health concerns with hospitality employees because they have to work and are in an environment with maskless individuals. How can an operator communicate and work with their team to reduce their anxiety?
I think one of the key things, Cheryl, and we've seen this over and over during the pandemic, is communication. We can never over communicate enough to our employees, whether that's employees in a hospital, employees in a restaurant, a hotel. And even if we don't necessarily have all the information, I think explaining what we do have and the policies that we are implementing, and the employees feeling that they're knowledgeable and aware that the leadership of the restaurant, hotel, whatever it may be, are being very thoughtful and putting their safety as a top priority is really, really important. And then there are different models that we see. For example, in the Lead with Care program, there's a hygiene officer, and that really is, and this is a model that we use a lot in healthcare. It's one of the frontline people or people working in the area day to day, who is really taking some responsibility for the safety and the education and the implementation of the policies with the rest of the staff. And it really is so that it doesn't seem like it's a really top-down authoritarian type of situation, but really that there's a collective feeling of us, all wanting to keep each other safe. I think this far into the pandemic, and as Chrissy said earlier, who thought that close to going on well over a year and a half now since we would have started in Hopkins, who would have thought that we'd still be knee deep in this evolving pandemic? And so COVID fatigue is a real thing, and it's a thing for our employees and also a thing for our guests, right? And I think what we've seen with COVID is that it really brings out a lot of people's inherent personality, but brings it out even stronger. And so you can see across the full range of even responses to COVID, some people are extremely cautious and extremely reticent to really do anything, despite maybe taking on all the safety procedures. And then other people are much less risk averse and are much more flippant about the basic safety precautions. And so it's very difficult, and particularly with guests, when you have across this spectrum of people. I think some of the communication pieces that the Lead with Care program has, and I'm sure Chrissy can speak to more, but it's really around that communication with the guest when it comes to those difficult situations, like not mask wearing when masks are expected, etc. Is challenging. But the things we would say for the employee is to, if they're in any sort of situation where they feel unsafe, is just to move away, because the more distance that you have between anybody who potentially is infected and not wearing a mask, the better. And the closer you are to them, if they do happen to be infectious, the more air particles, etc., are in the air around them. So even moving away can help if that person is potentially infectious.
Thank you. Chrissy, would you like to add anything?
No, I think Claire really covered it well. For us on the mental health front, I think, both the COVID fatigue and also the labor shortages that we're seeing across the industry, like that is truly weighing on on so many of our people, and it's not just in the U.S., it's across regions. So, for us, I think, the communication, as she mentioned, is key for all of our employees. We offer monthly webinars, so we have webinars with Dr. Rock and Dr. Z. It provides a forum as well for Q&A. And I think, them seeing our investment as a company into, the Lead with Care program and the consultation from Johns Hopkins has been really, transformational for us, because there's so many questions that we can't answer as operators. And we want to make sure that we're making any health and safety decisions, not necessarily based on local jurisdiction, but based on science and based on what, both Clare is seeing firsthand in the hospitals treating patients, and Dr. Lee is seeing, as they're teaching more and learning more about COVID. So that has been, for us, really our North Star, and we make it really easy and accessible to ask questions for the employees, as well, providing different resources around mental health that they can have at home as well as at work. So I think we recognize no one thought we'd be talking about this for this long. We recognize that, the overall weight of the pandemic, as well as, just being in an industry that's really challenged and, in many cases, short-staffed is difficult for employees. And so, making sure that we can provide them resources as well, just, listen to their concerns and get their suggestions on what can make life easier for them is critical for us.
Thank you. We have a question from David, and this is for the panel. What are your thoughts on hospitality brands implementing mandatory vaccinations for their staff or asking for proof of vaccinations during job interviews? Is this something that will become a global practice down the line? Anyone want to take that question?
Well, I think we are seeing that in certain parts of the world, and obviously it's a challenging situation. But certainly in the healthcare industry and hospitals, this is not new to hospitals. There's already mandatory flu vaccines that's in most hospitals across the US. And so many places, the COVID-19 vaccine is mandatory there, because we're interacting with obviously very sick and vulnerable people as healthcare workers. And so important that we be vaccinated, but also as a workforce preservation strategy, right? It's extremely difficult, like even Chrissy talking about the, keeping hospitality open with operations. There's similar issues actually across healthcare and many other areas with keeping nurses, plus all the other staff that are nutrition, dietetics, pharmacy, housekeeping, environmental cleaning, etc., that are needed just to keep the operations of a hospital ticking over. And I think we're seeing in certain parts of the world, there's just more focus on the concept of the vaccine certificate and proof of vaccine for people to, enter into events and enter into dining areas, etc. And certainly when you see that start to come into a society, it really means that more or less everybody is going to be vaccinated, right? Because if they're not going to be able to do any of these types of activities. And so in those countries, it probably is nearly by necessity that all the employees will be vaccinated. So that's kind of I think a plus for the employers, at least of those areas, because they don't have to mandate the vaccine necessarily within their workplace, because basically it's mandated for everybody across society if they want to do, avail of many activities. I think it's difficult. What we have really focused on, and I think what Dr. Zenilman and I bring, is the value of trusted experts. And so it's really been seen, particularly in the US, where this is an extremely politicized matter, that trusted experts who are non-partisan, no political affiliation whatsoever, and are really just experts in the science, experts in the epidemiology, experts in the infection prevention, giving advice and really advocating for people's safety for themselves, their families, the people they're working with, etc., and really reinforcing the positives of the vaccine, addressing the so much misinformation out there has been a strategy that we have really focused on. And so I think that it's really an evolving area.
And Dr. Rock, you mentioned, if an employee or if anyone in society wants to go out and do certain activities, that they need to be vaccinated. And actually, JK had a question from San Francisco because they are a large-scale caterer and restaurant operator, and they're mandating vaccination for their team members. And then in the city of San Francisco, indoor dining is only allowed for vaccinated guests. So it will be interesting to see how, and in New York City as well, how that vaccination for dining will impact. So Ben, I'd like to ask you, we hear in hospitality operations that there's been some challenging guests as who are dining out and who are wanting to leave their house, especially if they were in lockdown. Have you provided any specialized training for your team or just had conversations about how to work with challenging guests during this time?
I would say mostly it's kind of been with our management. And, we talk a lot in our business about empathy and trying to, be in the shoes of the guest and get where they're coming from. So really for us, it's just been more kind of preaching, just put yourself in their shoes, understand, we've been out there working this whole time. Other people, this is their first time going out in a year. They don't know what the world's like right now. It's our job to make them feel comfortable, to give them a great experience. And really, it's just patience. And it's been tough because we have a lot of people, I would say through this experience as a company, we've become very, way much closer, right? Like as a family, we've all had to lean on each other, spend a lot more time with each other than we probably ever wanted to. And so we've gotten that connection, and now it's kind of helping our guests and just having everybody's back and knowing, your upper management is there if you need help, and people are always to help you. But, everybody's different, everybody, it's like we say, everybody's idea of a medium rare steak is different. So it's just, you can put yourself in their shoes.
Thank you. We have a question that is very interesting, and Dr. Z, I'd like to pose this to you. This is in regards to restaurant cleanliness. Have you explored dry hydrogen peroxide? And they mentioned that Chick-fil-A uses a system in hundreds of restaurants with outstanding results. So this kind of ties back to questions that we spoke about earlier in the hour. Dr. Z, what are your thoughts on that?
Yeah, so I'm not aware what the Chick-fil-A, approach is, since unfortunately I don't go to Chick-fil-A. But hydrogen peroxide, I'd say basically every restaurant and every food service establishment has to abide by food safety guidelines, and the food safety guidelines that are used, pretty much everywhere, certainly in the United States, and which are subject to local health department inspections and so forth, are more than enough to prevent COVID. Because again, to Claire's point and the point that we've been making, throughout this is a respiratory disease. It's a respiratory illness. It's not a foodborne disease. So I don't, what we do in the hospital sometimes is somebody has in certain times when we will use hydrogen peroxide to fumigate a room, but that's not, I don't think that's what they're talking about here, or when the restaurant's closed. even if that was the case, there's no reason to do that, because good air handling will get rid of whatever viral particles are in the air. And again, surfaces don't seem to be as much of a problem.
Thank you. Chrissy, a question.
I would add that there are a lot of vendors trying to sell stuff in this space.
Very true.
Experts. Chrissy, Shakira, an MMH student, class of 22, asks, will the new ways of incorporating to-go foods, such as the meal kits, be a new normal? Or do you see a time when the innovations developed from COVID will no longer be necessary?
That's a good question, Shakira. I think, we really have to see what the demand is. I think in certain parts of, the world, in Asia, as an example, at our property in Hong Kong, they've done these beautiful takeaway tea. So it's like a high tea service, and it's served in this beautiful takeaway tower. And, there's so many creative ideas coming out from chef created meal kits that people can cook at home to, full dinners for holidays and things like that. I think it's great that we've been able to stretch that, capability within our hotels, and it's really kept our teams, inspired and kept them working. And, we're really fortunate for that. But I think it just depends on what the customer demands. And I think it goes back to this strength and agility that we've developed over the course of the last, 18 plus months, is, the ability to really respond to whatever the market is asking for. And, our team strength in that respect. So I think more to come. I think one thing that we've seen in the hotels that will continue and is here to stay is just the use of, our digital platforms. So we have a chat platform that can be used across the hotels to request anything, services, meals, cars, whatever you need while you're at the hotel. I think though we had much lower occupancies, as you can imagine, through the course of the pandemic, we saw this increase by, I think, three to four times, the usage per guest. So it's something that it's easier for guests, it's easy for the hotel teams to respond to. So I think things like, our mobile app and chat, those will just continue to invest in and develop, because those will continue in the foreseeable future.
Thank you. Well, in the last 5 minutes, I would really like each of our panelists to reflect and kind of think about the future. And I understand that the future is very hard to predict at this time. Dr. Brock, you said even in a couple of weeks, this information might change. But could each of you share a future prediction about the hospitality industry, or what we can do to protect each other and our communities? Someone like to start?
Sure, I'll start. I think the prediction is that, this is, I think a certain prediction is that this is going to be with us for a long time. It's going to be with us a while. So this is something we're going to have to adapt to. I think we're going to be seeing an increased focus on vaccination. And I think we're going to be seeing ways that we can manage our lives living with this, and how to go about our daily business, and, including hospitality and restaurants. And it's not a straight path.
Thank you, Dr. Z. Ben, would you like to go next?
Yeah, I agree. I think, for the most part, vaccinations will definitely be a big part of the future. But I'm very, listen, I gotta be, right? I'm optimistic. I think, I think if anything, this showed, especially when things quiet down, people were rushing to get out. We're still very social people. We still want to be together. People still need experiences, and we just had, it's kind of up to us to provide them, provide those experiences in maybe a different way. Be more mindful with your employees of keeping them informed and keeping them safe. and designing things, designing experiences that kind of have the safety of your guests in mind as well. And I think as long as you're doing that and you keep on thinking about, and listening to the guests and what they want, I think our industry is very, very strong future.
Thank you.
I agree with what Jonathan and Ben have said. I think that we are going to have to continue to be agile, and there's definitely more curveballs coming our way. And I anticipate that there's going to be lulls, again, followed by surges like what we've seen. And I think there's a significant risk that we're going to see, more and more variants that are even more competitive or more destructive, I guess, than what we've seen. I do think, there's a lot of innovation that's happened in this space, right? When we think about healthcare, like telehealth or telemedicine has come on 10 or 15 years in the space of a year. And really, if I think about things that need to stay, that was just such a huge advance that has allowed people, from example, out of state, receive telemedicine care from Hopkins physicians. And I think there's huge advantages to that innovation that has allowed for that access. And I think that the areas in hospitality and restaurant that are really focused on those innovations, I think are going to do well, because I think that the consumer now is actually very well educated. Like when I think about 2 years ago, nobody really would understand how even flu transmitted and how these infections transmit. And now we have, most people understanding of the difference of case rates and positivity rates and what they can do to protect themselves. And I think it was interesting, Ben, when you were saying about the spacing of the tables, because I think certainly now if a lot of people were to go into a restaurant and see a lot of tables in close proximity, it would be sort of jolting to their eyes, because they're just much more informed about prevention and what their personal risk is. So I'm optimistic for the, hospitality and restaurant industry, but I think there's still great opportunity for further innovation and just making sure that our guests are feeling safe.
That's great. I think I'm with Ben. I think that I'm optimistic that both the hospitality as well as the restaurant business will bounce back. And I think people, what this is definitely solidified is the need for people to have human connection, and our ability to adapt and do it in a way that's safe is really been sharpened over the last year. So I think as we think about things that are probably going to be normalized from an operations perspective, things like wearing masks. So if employees want to wear masks during things like, flu season, periods like flu season, because, Dr. Z and Dr. Rock have also informed us that, the influenza over the course of the last 18 months has gone drastically down. So things like that, I think will become more normal, where we've seen that for a while in the Asia region. I think that will become more normal as we go forward. Those physical touch points, so widespread availability of things like sanitizers. If guests want to sanitize their hands, I think those will be here to stay. And as we think about design, just considering those sensitivities that people have as we emerge from this will be important as well. But I do think there's nothing that replaces human interaction, and our ability to do it in a way that makes people feel safe and provides the right level of protection for our employees is something we're really confident that we've gained riding this roller coaster. So those are things I think as we look forward that would be part of our new normal.
Thank you. Thank you so much to our amazing panelists for sharing their knowledge and insights today. Chrissy, Dr. Rock, Ben, and Dr. Zenilman, thank you so much. Thank you again to the Center for Hospitality Research, Cornell, and the School of Hotel Administration. thank you all to all of you for attending and listening today, and please stay safe. Thank you, and healthy.
Thank you, Cheryl. Thanks, everyone. Bye.
Thank you.
Thank you.